County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to be talking a lot about internal medicine and endocrinology tonight. We have Dr. Anna Silva, board-certified internist, so that's internal medicine, and endocrinologist with Florida Endocrine Consultants, PLLC. Dr. Silva, how are you doing this evening?
I'm awesome. Thank you for having me again, David. How are you?
Great. I am great. And I always say I'm ready to take our listeners and viewers on this adventure of health because we always learn so much from the doctors we have on. Interesting thing. So this whole, everyone is starting to get interested in telemedicine, as the pandemic hit. However, you had already started with telemedicine before this COVID-19 pandemic. Tell us a little bit about, virtual medicine, your telehealth service, because this is an opportunity for people just like we're talking here. Of course, we're heard on the radio, but as we're seeing here, it can be like an office visit. I haven't done this yet, but I know people who have, and they found it very beneficial. So I'll let you describe your service.
Sure. So I think telemedicine is here to stay, and I'm happy for my patients because there's no more of that time to drive to an appointment, sit in a lobby, wasting 3 to 4 hours a day. You literally log in. Most doctors use an app, and I actually use a service where you get a text. There's a link. You click the link, you enter your date of birth, and you're connected to me, just like this. I see you, you see me. So I ask people to do that about 5 minutes before their appointment. So they're actually granted their entire appointment time also. So with endocrinology, I almost sneezed. With endocrinology, the majority of the visit is actually getting a good history from someone. So telemedicine does not interfere with that. And we are lab gurus, so we will review your blood work with you and discuss your treatment options. People are able to click a little button on the app, and they can send me any attachment that they would like. If they need me to see, there's something on my foot, I'll say, okay, turn the camera to your foot and show it to me. And I can generally assess it then. So I love telemedicine. I started it to make patients' lives easier. And most of the patients are really happy with it.
That's great. Yeah. And I know you've had this idea for years and is kind of, on the back burner, but I'm glad you started it and, got going. And you made some great points there, convenience. Even now during COVID-19, driving around South Florida, it just takes so much time to get everywhere. And I'll tell everyone this. I recently went to the doctor. And I had everything written out, and I was in such a hurry because I knew I wasn't going to have much time. And I still didn't get to some of the stuff that I wanted to talk about because, average doctor visit is what they say, 5 to 7 minutes, if that. So you're offering people time to really think about what they want to share with you. And at the same time, you're taking in that history, which is so important to healthcare, right?
Yes,
Yeah,
so
that is
that was
great.
part of my idea also. I wanted flexible scheduling. I Most people know I'm going to ask a lot of questions. I know that I'm going to need time with my doctor. So the shortest appointment I actually offer is 30 minutes. And you get the entire 30 minutes with me, not with the medical assistant during whatever. But the average new patient, actually, we spend an entire 60 minutes going over all your past medical, going over labs in detail, discussing what is the next plan of action, a lot of education so that my patients feel really comfortable and understand what's happening. I think that's a huge part of medicine, is having you as a patient understand what is happening so that you're comfortable and you know what to look for and what questions to ask.
Of course, I'm going to give out the website now, and then I'll give it out a few more times. It's endocrinehelp.com. So it's the word endocrine and help.com. There's a ton of info there. The number's 561-944-6553, but you definitely want to go to endocrinehelp.com. Put that in your browser. So people, are they using more of phone devices, tablets, or laptop like I'm using to talk to you? Is there a preference?
So
Does it matter?
it doesn't matter. Most of my patients, because they're back to work, right? We kind of opened everything up. They'll just go into their office, they grab their cell phone, and they talk to me on their cell phone. Prior to opening up, a lot of people were home, so they would use their desktop. But the reality is the app that we use, or the link, is very easy. As long as you hit OK to allow camera and video access, the quality is the same.
That is fantastic. Again, it's endocrinehelp.com. I read on the website this is open to everyone in Florida. Is that correct?
Correct. So because I'm licensed in the state of Florida, I can practice and manage anyone in the entire state of Florida. And we actually just opened up for New Hampshire and Alaska because they were in need of endocrinologists. So I got licensed there sometime last week. So people from Alaska, I can help you too, because they have a need and there aren't many doctors out there.
Definitely. That is fantastic. So Florida, New Hampshire, and Alaska, we have a lot of people down here in South Florida from, all of Florida from New Hampshire. So that's great news, who come back and forth. I've been there a few times. My uncle used to live up there. So, but Alaska as well. Wow. That is fantastic. And people can just book right on the website. Is that the best way? And then they can get that text that they, with the link?
Correct. So if they go on my website, there's a button that says book now. It pulls up our availability. I'll get a message saying there's a patient asking for this appointment slot. As long as there's not someone else that within a short amount of time asked for the same appointment, they're usually granted. My website also has a chat bot, so you can chat, send me a text, or if I'm with a patient, my assistant will answer that and we're able to schedule. I do try to see patients within a day to 2 days of their request. That way they're not waiting too long for an appointment.
That's fantastic. And I can attest that Dr. Anna Silva gets right back to you because, I've emailed her and texted her and called her before, and one of the quickest, doctors ever to get back to me. And I'm being honest about that. I really am. You're also fluent in Spanish and Portuguese as well. So
Yeah.
not only English, Spanish, and Portuguese.
Yes, I was born in Brazil, so I speak Portuguese, and I trained in Hialeah, so I got to learn how to speak Spanish, and I see at least one Spanish-speaking patient a week.
That's fantastic. Huge Spanish-speaking population down here in South Florida, and also a huge Portuguese-speaking population with a lot of people from Brazil here, now call them I say Florida because this is all Florida now, home.
Correct.
That is fantastic. It's endocrinehelp.com is the website. Again, ton of info there. We have a couple minutes before the break, so I want to talk a little bit about concierge medicine because you also offer that. That is like kind of a membership-based program?
It is. So I did concierge medicine because I believe patients should have direct contact with their doctor. So in order to do that, you have to kind of limit the number of patients in your practice. And to offset the cost, we do charge a membership fee. but patients have my cell phone. So if there's ever any questions, they're texting my cell phone directly. They're offered after-hour appointments, holidays, weekends, in order to be convenient for those patients.
Okay, and they can be seen via telemedicine and in the office? Is that how that works?
So right now we're only doing telemedicine because of everything that's happening. Once everything is safe, we can consider being in office, but right now everything's just virtual.
Well, right now we'll just say telemedicine because that's the safest way. You know, we're trying to flatten the curve. We say that every week on this program. So that is great. Again, it's endocrinehelp.com, and there's great options there. So most of the appointment times are, you know, during the day, convenient times?
They're mostly during the day. However, I've had patients that said, hey, I really need to see you, but because of my work, I can't see regular hours. And I've been able to see patients at 7 in the morning, sometimes at 7 p.m., because I understand it's important to take care of your health, and sometimes our lives just don't allow that to happen.
Of course. Well, again, it's endocrinehelp.com. Let's take a quick commercial break. And on the other side, since we talked about telemedicine and concierge medicine, we'll mention that again. We'll talk about some of the areas of interest Dr. Anna Silva cares for with internal medicine and endocrinology on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Yeah, that's right. You can always call in. We have a board-certified internist and endocrinologist here, Dr. Anna Silva with Florida Endocrine Consultants. The website is endocrinehelp.com. Dr. Silva, we talked a lot about telemedicine you're offering in Florida, New Hampshire, and Alaska. That is fantastic. What a great availability to see a doctor over telemedicine in these times, these uncertain times, very safe way. We got about 10 minutes, so I want to go over a little bit of your areas of interest. I mean, board-certified internal medicine and endocrinology, that's a lot, covers a lot. So let's talk a little bit about some of the more, common ailments people reach out to you for, or that you discover from, talk to them about their history. What are some of the more common people or things people see you for?
So the three most common visit types that I see are thyroid patients, diabetic, and patients that are trying to lose weight. Those are my top three, and probably my top three favorites as well.
Oh, that's great. Yeah, definitely help people out, with those ailments. Thyroid, it seems like it's much more prevalent than when I got into healthcare. Is it growing? Is that an issue that needs to be checked, or is it just that our population is aging, or?
I think a lot of it is awareness. Most people did not know what a thyroid was. If you ask our parents' generation, they never really talked about it. But because of social media and more internet access, people often Googled their symptoms before actually even seeing a doctor. We've learned more about thyroid. So patients are actually initiating more of that request to have their thyroid checked. I think that's the cause of the increased number of patients presenting with thyroid disorder.
Yeah, and it's important too, because if that disorder is found at an early time, preventative medicine can really help someone out, correct?
Absolutely. So thyroid is basically in control of how fast every part of your body works. So we're talking about brain, heart, bones, everything. So the longer you go with hypothyroidism, which is low function, people just don't feel well, and it can take some time for them to feel well. But the more dangerous side is the long-term damage of overactive thyroid. It can be very detrimental to the heart and to the bones. So we really encourage patients to be seen relatively quickly so that we can get them under control.
Yeah, very important. And you can book a telemedicine visit at endocrinehelp.com. Let's talk a little bit about diabetes, and then also very important, glucose monitoring. That is something else you offer in your practice?
I love glucose monitoring. So I personally became a diabetic twice. Every pregnancy, I became a diabetic. So I got to live in my patient's shoes, and it has made me very humble to what it's like to live the life of a diabetic every single day. And it changed my perspective and how I manage patients. Diabetes is on the rise, guys. And as we are gaining weight because we're sedentary now and we're kind of depending on meals being brought to us, diabetes is climbing as well. What we are told is that by 2030, we're going to have about 75% of the population be considered obese, and diabetes tends to lag behind about 5 to 8 years. So that makes me very concerned. They were also thinking that about 1 in every 4 to 1 in every 5 Americans is actually pre-diabetic or a diabetic, but they just don't know because they haven't had testing yet. So I highly encourage my patients, even if they're seeing me for something else, if there's any remote history of diabetes at all, to just get a screening blood test to make sure that we're not diabetic. Or if you are pre-diabetic, there's a lot we can do to delay becoming a diabetic or even prevent it. There's a lot of new, amazing, exciting things in diabetes, but the coolest thing ever is continuous glucose monitoring. It's a tiny little device that you put on yourself with a little sticker, basically, and it sits on top of your skin. Most people wear it behind their arm or on their belly, and it will constantly check your blood sugar. So every 3 to 5 minutes, you'll look at an app or on a little, it looks like a phone that they'll give you, and it will tell you what your blood sugar is. But even more exciting is it will tell you where is that blood sugar going. Is that blood sugar trending up or is it trending down, so that we can make better choices. If I'm eating something and I see that my sugar is climbing very quickly, my education to my patient is, you're going to think about that and say, really, should I be eating this, or should I change what I'm doing right now to improve that? And the other thing is for safety. So I'm about to drive and my sugar is dropping. I know that before I get into that car, I'm going to go and have a snack and wait for my sugar to stabilize before I actively go do something. So in my honest opinion, it's the best thing that we can ever provide for our patients. It's educational, it keeps them safe. And most people, just putting them on that, will have their A1C, which is their average sugar, improve by 1 to 2%, which is more than most of our pills can do.
Yeah, I've seen those on people, and I've always wondered what those were. So thanks for, clarifying that. And everyone, go see a doctor. Go see a doctor like Dr. Anna Silva, telemedicine, and she's mentioned prevention. That's the key. Like, if you're seeing a doctor, they can come up with a plan. They understand, the chemistry of the body like no other. Board certified. She's board certified internist and endocrinologist. So definitely, endocrinehelp.com is the website, and definitely, book a visit so you can find out, how you can take better health and have a better quality of life, because it's very important. As Dr. Silva said, diabetes is on the rise, and it's not going to flatten out anytime soon. Dr. Silva, you also treat polycystic ovary syndrome. That is, of areas of interest in endocrinology and hormone replacement therapy. I know we're talking about a lot of topics here. We don't have too much time, but can you tell us a little bit on those two?
Sure. So polycystic ovary, what I explain to patients, is basically diabetes of your ovary. We have insulin resistance, which is altering our female hormones, and then it's leading to irregular periods. Some women get acne or excess facial hair, and they do have issues with fertility. So as an endocrinologist, we will do blood work to see if you do have the diagnosis of polycystic ovarian syndrome, or do you have something else that you need to be seen by OBGYN or even another specialist. But if it is polycystic ovarian, we start a treatment plan. Oftentimes, it's lifestyle changes along with medication, so that our patients can lose the weight, reverse that insulin resistance, and at some point be able to come off of medicine, have normal periods again, reverse their acne, and improve their fertility.
Yeah, a ton of info here. Again, it's endocrinehelp.com. We only have about 2 minutes left, so I'm going to talk about a couple of the other areas of interest Dr. Silva treats. I'm just going to mention them: overweight care, obesity, weight loss services, nutrition counseling, meal planning, prescription medications. These are all things that Dr. Silva can help you out with a telemedicine visit. She's fluent in Spanish and Portuguese, English as well, obviously, and it's endocrinehelp.com. Just one quick question. We're talking a lot about COVID-19. We got about a minute left. Are COVID-19 high-risk categories for diabetes and obesity?
Absolutely. So diabetic patients have a lower than normal immune system, and having obesity, your body is more inflamed, and you are not also considered to have normal immune system. So if we combine the two, those patients overall have an higher risk of, when they do become sick, having it be a more aggressive illness, and they tend to have more complications.
Wow, well, this has been a great interview. I hope everyone archives this and uses it later. I just have to say one thing, Dr. Silva. I've been doing this show since mid-March, connecting with doctors, and here we're talking about telemedicine. I haven't had this good of a connection with anybody I've interviewed, this technical connection. So this just tells everyone, like, this is the kind of telemedicine visit you're going to have. You're going to be able to hear the doctor, see the doctor. It's going to be clear. That is a great connection you have.
Thank you, David. I worked really hard in setting up a good system.
You did. You got a great internet connection as well, because I haven't seen this yet. So my producer's going to be very happy. Let's just say that.
Awesome.
Well, we'd love to have you on again. I know, everyone, we talked about so many different topics, but again, book a visit with Dr. Silva, endocrinehelp.com, 561-944-6553. And they're not kicking me off yet. So this can be covered by insurance, these visits as well?
So weight loss, unfortunately, is not considered a medical disease. So insurance companies do not pay for weight loss visits. However, we offer multiple different options for weight loss, and they're very affordable. So most of my patients don't have an issue with that whatsoever. As far as concierge medicine, it's not considered also something that insurance companies pay for, so that is cash-based.
Okay, good to know. But she can answer all your questions. endocrinehelp.com, 561-944-6553. Dr. Silva, thank you so much. We'd love to have you on again.
Absolutely. It would be my pleasure. Thank you for having me again.
Thank you, and we'll see everyone next time on the You and Your Doctor Living a Longer and Healthier Life show.
Thanks, David.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer